Okay. Um, okay, we wait for 2 or 3 minutes. We wait for some of the members to come in, and then I will do an introduction and we can start. All right. Good evening, everyone, and hello and welcome to Janice Live at 4 p.m. Every day at 4 p.m., we have live shows exclusively for the 60 plus to tune in and actively join buzzing conversations around special interests, from movies to live comedy, health and fitness, and much more. Janice Life is an online and offline platform designed for the needs of today's 60 plus, made by the 60 plus. For all those who are watching the live stream on a YouTube channel at Genes Life Official, you can actively join and participate in the live sessions on the Genes Life app. To do so, you must be 60 plus. You can download and subscribe to Genes Life on App or Play Store, and you can also access the app on a web browser. Log on to genes.life for more info. You can also gift it to your 60 plus friends and family members. You can also WhatsApp us on 882-881-6060 with any questions, comments, and content. A quick set of guidelines for all the members in the room today. We request you to put on your cams so the host can see you and reach out to you. Your mics will be on just in case you have any noise around you. I'll mute you temporarily. When you join the conversation, you can take up to 2 minutes. We request you to be respectful to everyone on the show. You can use the chat box here or raise your hand in your video or with the Zoom feature to give us a signal. I now pass on the spotlight to our host for the day for the show Doc.Talk Live, where every first, third, and fifth Thursday of the month we will have Dr. N. Prem, who will be helping our members from the physicality perspective. And then on the second and the fourth week, we also have Rohini Rajiv, who will be sharing things on mental health. So it's Doc.Talk Live is a show that is looking into your holistic health, both mind and body. And today we start our first episode with Dr. N. Prem, whom I would now invite to take over. Thank you.
So good afternoon, everybody. I'm Dr. Nagnath Narasimhan Prem. I'm a consultant in geriatric medicine at Jaslok Hospital in Mumbai. So I am just going to take a topic which I feel which is very important, that is to know about the needs of older adults. Uh, I'm going to be just highlighting what maybe you might already know, but at the same time you should know more about. So, why is aging and health important? So, one of the most important things which we maybe already know is that every older adult is different. And this is not something that I have been saying. This is very much been saying by the World Health Organization. So, actually, this decade, that is from 2020 to 2030, was supposed to be the decade of healthy aging. So, of course, we lost or maybe we gained, we can say that, because in the last 2, 3 years, starting from the pandemic, have actually made us think even better about elder care to a greater extent. So, maybe we did gain out of the pandemic, although, yeah, the pandemic was not one of the best things to happen. So, some older adults might be very independent. They might actually challenge even maybe 30-year-olds, just breed them back in blue. Like, for example, Usha Soman, the mother of Milind Soman, the model is actually quite fit, or maybe even more fitter than Milind Soman. And she's 70 plus. But not everybody is the same. So some need, some require assistance. So this assistance could be in everything. So, for example, bathing, maybe even moving, even taking bath. But what is important is health is what is crucial to know or to expect to how you will experience old age. The more healthier you are, the better the older age will be. So sometimes what happens, you might be in the right side, but you might go to the left. If you get maybe an illness, then you might require assistance. But you come back to being fit again. But a lot of people do not recover. So the important thing to understand is health is crucial. So concentrate on your health. Now, what are the factors which influence health? Now, health is not as easy as we see it is. It is something which is in within us, that is individual, and the environment, because we don't live within ourselves, we live with an environment. So it's always the interaction which occurs with us and the environment. So as far as individual is concerned, your behavior, so it's when you sleep, what amount of water you take, what food you take, whether you have any extracurricular activities like drinking, smoking, uh, whether you are exercising enough. So all these behaviors are important. Then secondly, one has to understand that if you're 1 year old or you're 80-year old, your body is getting older. So age related changes do happen. So if you're 80, then your kidneys, your lungs, your brain, everything is getting older. So you cannot just restrict your brain thinking, no, I'm not getting older. Yes, age will have its changes. Then genetics. A lot of times diseases are very common in families. So somebody who has diabetes, maybe the mother, the father, brother, sister. So the chance of you getting diabetes actually might be even more. It's not that you'll always get it, but if you do get it, it shouldn't be surprising. So if you know already that your parents, your grandparents, or somebody has diabetes, then you should understand that you should take enough precautions like health checkups to at least make sure that you don't get, or if you get, you control it. Then disease. I mean, how wonderful life would be without disease. But that's how life is. You do get diseases, and unfortunately, sometimes you get one, you get two, you get four, five together. But the more the diseases, the more it influences health. But that's about you within. But what about the external environment? Now, housing matters a lot. Now, the way where you live. Now, for example, if it's on the ground floor, well and good, you're able to maybe go easily wherever you want. But what about if you have bad knees and it's the first floor and you don't have a lift? So it might actually restrict your activities completely. So that's why where you live matters and the type of housing matters, whether it's older friendly or not, because standard commodes might not actually be helpful for an older person. Low places are not good. Having the best marble floor is not good. So a lot of times housing and the way the house shapes up as you get older is also important. Then assistive technologies. One always has to be cognizant or remember that you can get better with help and not necessarily getting dependent on help. So nobody has a problem in actually using spectacles because it's very commonly used. But when it comes to hearing aids, not every older adult wants to use. Of course, these days hearing aids you can't even see. It's just like a earbuds, which are used very commonly. So I think I encourage you to actually use it because using makes you more independent and not necessarily makes you dependent. Then transport matters. I mean, public transport is getting better, but not the best for older adults still. For example, even when an older adult who's independent has to take a bus, I think the gap between the stop and the step of the bus is still pretty much not that elder friendly. So the entrance itself becomes a challenge. So it's not that you don't want to take it, but it becomes difficult. So seats are available, booked for older adults, but we are still getting there. We are not as elder friendly, but we are much better than before. Then social activities, social facilities. Now, everybody would remember that COVID cut off the biggest thing that you could have, your social life. So you suddenly realize that, oh, actually, I cannot go out and meet people. Bus, but what happened? You obviously adjusted, you met people online, you learned technology. So I mean, the older people never cease to sort of, I mean, dazzle us, and you you upped your game. So the fact of the matter is, social factors are very important because you might be fit mentally, physically, and you don't have nobody to talk to. That is not really a great thing. It could be your clubs, it could be your kitty parties, it could be your events, it could be your visits to the park, it could be just going for birthdays or even celebrating your anniversary. Social activities are very important, and that's why social facilities are very crucial for your health. So how are the older people different? I mean, I kept on saying that you are different. So no elderly is the same. So the way your body acts to stressors is the one what changes, and it's different in every older person. It's not only age based. A 90-year-old who's fit might react better than a 60-year-old who's unfit. So age is actually just a number. It's a cliched statement, but it's true. Then multiple comorbidities. So, for example, if you have diabetes, hypertension, history of stroke, Parkinson's, multiple disease, obviously it will be difficult. A typical disease presentation. Not every time a classic, I mean, whatever textbooks we read, an older person will actually present that way. You expect yourself, anybody who's having a pneumonia is basically a chest infection, is expected to have cough, fever, uh, and maybe difficulty in breathing. But it's not the case in older adults usually. In older adults, it is usually just altered sensorium, just talking some gibberish, and you realize, okay, actually the older person has pneumonia infection, and then that's the reason that they're talking. So a typical presentation is very important. Then what about multiple drugs? Again, life would be great if there were no medicines. But with disease, sometimes you need to take drugs, but every drug has its side effects. Every drug can interact with your body and within itself. So multiple drugs is always a challenge. Then what about attitudes? Now coming first to the attitude of the older person themselves. Till 59 years, 364 days, everybody is fine. Oh, I'm good. And the clock strikes 12 that night and you become 60 and suddenly a lot of older adults feel, oh my God, I'm old. What am I going to do? So prepare for your older age rather than thinking what you will do later. So your own attitude matters. If you look at it positively, you don't even need to call it second innings. You just need to call it maybe the next phase of life where you want to maybe enjoy, where you will have time all for yourself. I mean, retirement is, to be very frank, not even the truth anymore. Most people are still continuing to work well beyond the retirement aging, but of course, maybe in different roles. Now, attitudes of relatives. Now, we as caretakers, relatives are very nice. We get very protective, we get ultra protective. Now, for example, a homemaker who loves cooking, she used to do the same in her house. But when she comes for whatever reason to visit or maybe stay with her daughter, son, family, why are you want to cook? You relax. You shouldn't be cooking anymore. You need to just relax, do something else, maybe hang out with people or do some, maybe watch TV. Why do you want to work? But you might actually be taking away the most important thing that that older person had. So be protective, but not ultra protective, wherein you take away things which are actually matter a lot to the older person. Then treatment challenges. Yes, in older people, it's not always easy to treat. Then social issues. I think social issues obviously matter a lot. Uh, Whether it's isolation, whether it's abuse, a lot of issues, whether it's financial issues, whether you're living alone, who's your support. So all these things matter. Then geriatric syndromes, which I will come to next. So I always like to dwell a bit into history. So geriatrics was basically derived from geras, which means old age, and itrikos, which means healer. And Ignace Leon Asher in 1909, he was a doctor in the US. He said, if we take care of people who are young, that is pediatrics, in a separate branch, then the older people need even more care. So there has to be a separate specific branch for older people, and that's how geriatrics was born. So this is basically a branch of which is concerned with the diagnosis, treatment, and prevention of disease in older people and the problems specific to aging. Now, you might ask me, prevention of disease as you get older? Absolutely. COVID was one of the biggest examples wherein we have one of the biggest vaccination drives, which would have not even been thought of maybe before the pandemic. Then, taking care of your health, exercising, eating, eating better, taking good amount of water, being social. These are all ways of preventing disease rather than only treating them. So in the geriatric age group, we also divide them into three, that is young old, middle old, and old old. So the young old is between 60 to 69 years, the middle old is usually 70 to 79 years, and the old is more than 80 years. So as far as we are expecting this to be even pushed further, I mean, people are living longer, so maybe the old might even cross more than 100. So, and who is a geriatrician? Now, a geriatrician or an elder care specialist physician is a doctor who is specifically trained to evaluate and manage the healthcare needs and treatment preferences of older people. Now, the reason treatment preferences matter a lot because maybe the knees are bad, we tell you that you should do surgery, but you are not comfortable with surgery. So if you say, no, I just want to maintain some oils and maybe just give me some very safe pain medications and I should be fine. So a lot of times discussion with the older adult and their treatment preferences matter a lot. Now, what are the common problems in older adults? Now, common problems include memory issues, balance issues. I think oral health matters a lot. The way you keep your mouth, gums, teeth is directly proportional to how well you eat. Then heart disease, weak bones, respiratory issues, hearing and visual issues, chronic diseases, and of course, cancer. Then geriatric syndromes. Now, these are specific to older adults. So delirium is basically altered behavior and confusion state. Dementia is, of course, everybody knows the dreaded D, wherein forgetfulness is one of the major issues, but other things like behavior, perception, all changes. Depression is more common than we know in older people. Again, it's a myth that all older people are depressed. So let's get that clear. That's not the case. Depression is common, but not everybody has it. Then falls. I think falls, the more we prevent it, the better. The more it happens, the confidence of the older adult is crushed. And with it comes, of course, maybe injury, trauma, sometimes the trauma which can't be seen. So the mental trauma is much more. Then urinary incontinence. Again, something if you're not asked about, it's not easy to express that you actually don't have control on your own urine. And it's very common again in both males and females. Then pressure sore. Now, pressure sore is something you would only get if you're bedridden. So the better, I mean, best is you never want it or see it. But it is quite common in bedridden people, especially because they are not able to move. Then frailty is a geriatric concept, whereas an older person who's frail and who actually gets a disease will recover much slowly as compared to maybe an older person who's not frail. And malnutrition. Malnutrition is not there only in young, it is there in old, wherein nutrition goes down, muscle mass is gone, bone becomes weak, and ultimately they are more susceptible to infection. Now, why are we worried? See, one of the most important things is quality of life. If the quality of life worsens, the disability increases, and that will trigger the cascade of dependency. Now, at any age, nobody wants to be dependent. And it's no different for older people. Older people also want to be independent at the last day they live. So I think that's very, very important. So if you see the health status of of a person, you might think that only medical conditions matter. Absolutely not. For an older person, medical conditions are, yes, maybe they are the way they present to us, but how free they are, what is their quality of life, how independent they are. So there comes the functional status. What is their memory? What is their brain health? That is the cognitive status. Affective status is basically whether they are anxious, whether they are depressed. Social support matters a lot. Economic status matters. Why? It helps us in knowing who we need to help, or it helps us in offering options wherein who will need help. Environment, as I already told you, internal, external, both matters. Even as something as small as having carpets in your home, which might be a fall risk, also matters along with the height of the toilet, which I actually mentioned. Then spirituality, religion and spirituality are absolutely different. Uh, so spirituality also consists of how an older adult is. So the health status, as you say, is not only about medical conditions, it's about a lot of other things. Now, what is successful aging? I mean, the mantra of successful aging is you should be able to avoid disease till whenever you can. You should have active engagement with life, and you should maintain a high cognitive and physical function. So that means a high brain and both physical function. So if you are able to do that, then you are successfully aging. Now, from the perspective of an older adult, what does successful aging mean? I am able to manage my home and where I live. So that is number one. Number two is I am able to manage my life and sense of self. Then, if I have issues, I am at least able to optimize my health. So I am able to exercise, I'm able to talk to people, I'm able to take my medications, do my health checkups, do my blood investigations. And if needed, I am able to enable my support team. So have a monitoring going on, wherein, of course, if there is a trigger, then I am able to go to the hospital, I am able to visit the doctor, or I am able to even, I mean, if I need an assistive device, I'm provided the same. So, what are the pillars of successful aging? I think this is very important. We always keep dwelling, and not all older adults do it. Maybe even young people do it. We always concentrate on what we can still do. I mean, what we cannot do, and we do not concentrate on what we still can do. So, for example, if there is a glass of water which is half, we cannot, it is half full or half empty. So, we have to concentrate on what we can still do rather than focusing on what we cannot do, and then improve that particular path. So that is optimizing, improve it to such an extent that we are able to compensate and overcome our weakness. So I'll give you an example. There is a pianist, there was a great pianist known as Albert Schweitzer. So he was an Austrian, if I'm not mistaken. Yeah. So he basically was beautiful on the piano, but he developed Parkinson's disease. So, as usual, the society gave a judgment that now that's the end of story. He's not going to play again. He was a great musician, but not anymore because he's got Parkinson's, which, as you know, can be quite debilitating. So it is basically having tremors, difficulty in walking, gait goes speed goes very slow. But he announced a concert, so everybody was very curious that what is he going to play or how is he going to play. So the concert was an absolute success. Why? Because he played only those tunes which needed his hands to tremble. So, in spite of having Parkinson's and tremors, he was still able to. So, that's what we call as successful aging. So, we always need to focus on what we can still do rather than focusing on what we cannot do. Then, of course, if you see what are the top priorities as far as older adults are concerned, one is healthcare, and very important. Regular health checkups, management of chronic conditions, preventive care. Mental health services are also as important because loneliness and depression has crept in to a great extent. Nutrition is very important, not only advising what to eat, but access to the same. Where do they get the food? Where do they get those nutrition services? Then social and emotion support, whether it's activities, whether it's counseling, support groups. Financial security is very important. I mean, as older adults, in fact, older adults are the ones who always advise their children, grandchildren to actually be sure about how they manage their money. Then transportation. People might love to want to go to something, but they don't access to the have access to the same. So whether it's 4 or 5 friends carpooling and going, all older adults, or somebody driving, or it's public transport, but transportation services matter. Then emergency response, access to emergency. If something happens, what can they do? Then I think intergenerational bonding matters a lot, wherein the young and the old come together. So of course there is this very famous movie in English which is known as The Intern, wherein it's an older adult who becomes an intern for a position in a shopping company, in a shopping portal, and he learns a lot of things, but the others learn more from him because he has experience in life. Then technology, I think the pandemic was the biggest example wherein older adults taught us that Zoom might be unheard of, but we know what Zoom is, or we know what Google Meet is, or and any online platform, and people have learned everything about it. In fact, now whenever we have meetings, they always ask us whether it's going to be in person or whether it's on online or whether it's hybrid. So it's reached that extent where people are ready to get connected with technology anytime. But yes, innovation is also needed in taking care of older adults. So what matters most? I think health, the relationships that older adults built, a sense of community, nutrition, establishing a routine, respect. I think the the line or maybe the quote which is said that older people behave like kids is absolutely untrue. Older people are older; they are not kids, so they don't behave like kids. So you have to give them that respect. Physical activity matters at any age. In fact, during the pandemic, we were really stressing on it because sitting was as good as the new smoking because people were not able to go out. But older people still managed. They went to their own, they were walking in their own home, they were walking outside their doors, they went to their own roof. So they did everything possible. And if they were going down, they actually were so organized that they were able to have an a timetable of going down, so that there are people who are walking for half an hour, but they are not meeting each other because of COVID, of course. Comfort matters a lot, financial security. The buck all starts in independence. The more independent an older person is, the more healthy the person is. Then quality of life, according to me, matters the most. Whatever your case, the quality of life, the more independent you are, the more you are able to do what life you're having at the moment that you have is what matters. The quality of life rather than the quantity in which a person might be bedridden for years together and not enjoying life. So, what are the five short tips for healthy aging? Always be active. Even moderate amounts of exercise is going to be good, whether it's walking, tennis. Of course, if people like water sports, it's good. Swimming is good. But know the body's limitations. Don't be active for the sake of being active and not understanding what your body can still do. Always be positive. Age is always a number. Smile often, laugh often. Don't take yourself too seriously always. You are being an inspiration to a lot of people you don't even realize. So, share experiences. Be curious, always keep your mind active. Stimulate yourself to do new things. There is no age for learning. There was one of the older adults that I know who wanted to know about aging. So he did a course about it at 78. He said, I should know what I'll age. So I should know my body better. So he did the course. So you can do anything. And in this era of online, you can just go off Google and there is anything and every course available. You can do it online, offline, everything. So get a new hobby, get a new skill that keeps your brain active. Stay connected. Always stay connected socially. I think that matters very much, whether it's in person, whether it's technology. Be vigilant. Do your regular health checkups, do your physicals. Don't ignore any new symptoms. And of course, try to keep a log of the concerning symptoms. So there is another thing that matters in older adults a lot, and that is the caregiver health. So as a caregiver, you might be an older person who's a caregiver also, or you might be a younger person who's taking care of an older adult. Try to accept help. Focus on what you can still do, what you can do. Get connected with people. Join a support group. Always set realistic goals for taking care of people. Seek social support. Your personal health matters more because if you are healthier, then you can take care of the older person better. See your doctor and always reduce stress. It's easier said than done, but if you're organized, you will be able to reduce the stress. So, as this is very clear in this, there is no such thing as age appropriate when it comes to play. But at every age, play is not a necessity, luxury, but it's a necessity. So, keep it light, but at the same time, try to take care of your health. And these are the wheels of life. We all have to go through it, or we might be lucky to go through it. Not everybody actually even passes the first. I mean, people don't even live one day. So if we are 70, if we are 80, we should be actually happy about it rather than think, why am I getting old? So we are all happy till maybe the nice stroller that we have here. But these days, even the wheelchairs are quite technologically advanced, wherein you actually have a screen and you can enjoy whatever you can. So don't let anything limit you. The most important thing is you never know who you're inspiring. So always keep sharing your experiences, and you don't need to be inspired by anybody else. You yourself have done everything in life. So take this as an opportunity to continue to inspire yourself. So, as William Wordsworth has said, come grow old with me, the best is yet to be. So try to focus on that and try to live in the today. You can't go in the past. Time machines are not ready yet. We said the same about smartwatches, but we do have them now. So maybe at some point we will have time machines. And don't worry too much about the future because again, you don't know what's going to happen. So live in the today, take all the positives in your life and live life to the best. Thank you. Thanks a lot for your patient hearing.
Thank you so much, Dr. Prem, for for this really nice introduction for a lot of us who are especially not 60 who happen to be on the call today. But I would like to open this up to our participating members today. If you have any questions about geriatrics for Dr. Prem, we have some more time left. So Varsha Singh or Sangeeta ji, if any of you have any questions, they shouldn't be consultative in nature, but if you have any broad questions about geriatrics, about positive aging, you can ask Dr. Prem right now.
Shadib, I would like to ask a question if that's okay.
Yes, please.
Okay, so doctor, thank you so much, for the session. I mean, I'm actually taking this up and I'm actually asking this question on behalf of my mother, who is actually a Janus member herself. But recently, what I've been observing for her is that she doesn't want to talk. She doesn't have that. Well, I don't know. I mean, there's nothing that has actually happened, like an event or a trigger that has actually happened for her, but she just doesn't want to talk. So she's visiting me in Mumbai right now. And earlier, when we used to do video calls, at least she'll just come on the video call and smile. But the talking has reduced a lot. She's actually 61 now. My dad is 68 and he's very, very active and everything. But apart from the fact that she's forgetting a lot of things, like putting salt in the food, or probably adding a lot of salt at times, these are the things that she's doing. But that's totally understandable, getting her age. But somebody who does not want to talk and does not want to tell us that what is exactly going on, do you have anything that we can try? I mean, yeah, I mean, because as you said that, don't see what what can be done is what you want to say. So we have done a lot of things for her, and we feel that some part of it might be neurological as well, because she has a fear of falling as well. So every step that she takes, she wants to fall. And she wasn't able to ask this question herself also right now, because she has that speech impairment and she's not able to talk at all. So yeah, anything that you would like to say here?
I think of course in her case, I think she has certain issues which obviously will need maybe more sort of interpersonal interaction with her, and that's how we'll
Hmm.
be obviously able to help her out.
Okay.
Because ultimately, if she has neurological issues, then we need to work around it rather than
Mm.
thinking that why she's not doing it, whether she doesn't want to do it. So maybe a closer look at her might only
Okay.
be able to, I will be able to give you a better idea.
Okay. Sure. Sure. Sure.
Yeah.
Okay.
Anyone else would like to ask Dr. Prem something, have a chat with him? Sangeeta ji, okay. Yes, please.
Is there something for improvement of our memory? Sometimes we forget the names of people or what we did yesterday. So for that, is there uh, any tips for that?
Yeah, so it's actually very simple. We have just stopped writing down things. I mean, maybe you're still doing it. I don't think a lot of us continue to do it. So I always say you should keep giving yourself memory aids. And that is by always writing down what you need to do. Number one. Number two, not only writing and forget it, going back to that list to see what all you have done. And on top of that, also put technological reminders if you're technologically savvy. You should not be dependent on technology only, but that should be helpful. So that is one. Second is, if to improve memory, it's always better. The brain gets really bored. I mean, you have to give it a challenge, whether it's acquiring a new skill, whether it's acquiring a new hobby. I mean, gardening is supposed to be very good. Doing crafts is supposed to be very good. Acquiring a new hobby is very good. Even as simple as brushing from a different non-dominant hand, the hand that you don't use, is actually supposed to make your brain health better. Then sleeping, I think, is very important. Of course, even on memory, we can obviously have a separate session completely, and sleep is also very important. The quality of sleep matters a lot. So all these things are very important from the time that and the amount of stress you have in life. A lot of times it's not everything is okay in your life, but not necessarily whether it's your children, grandchildren. So try to always analyze what you can do and what you cannot do also helps. And a lot of times, maybe we have to let them fight their battles rather than us taking stress about that. So, I think this is in brief. We can obviously have a session on brain health at some point because that's a very important thing.
Thank you.
Okay. Anyone else? I think because today we happen to have some members who are not or rather some audience who are not 60 plus yet. Do you have any questions about your parents like Mekha had, or even about your grandparents? Something that's broad and about geriatrics? Tanya? Uh, yeah.
Hi, doctor. So the thing is, I've got my grandmother who's currently in the hospital. She's just been admitted over the weekend. The, I've heard about this being a very common issue, but with mine recently, it's been very tough to get her to eat. And we don't know what exactly is causing, the problem because she's living away from us. Like she's living in Meerut, and I've got an aunt who is there. But suddenly it feels like, to attract attention, she will do such sort of things because everything will turn out to be normal, all her medical reports and things like that. But, these small little, stunts in a way, because time to time it will happen where she'll just refuse to eat. It's like literally asking for attention or what. It's really hard to decipher. And I see my mother struggling with it because she's making calls and asking her nurse, "What have you eaten today?" And she'll just say, "Oh, since morning, I've only had like, a small bowl of custard. I don't feel like eating right now." So it's just a constant struggle watching my mother probably getting her nurse to force feed her. You can't even force feed, to be honest. But with distance being an issue also, with everybody working and it's impossible at this point, how does one come to a consensus or, even convince someone for that matter?
Yeah, so I think it's all the root cause. So, for example, a lot of times lack of teeth itself should be a problem. Maybe painful gums could be a problem. Lack of taste is a problem. Smell
Mm,
obviously gets reduced as you get older. So maybe she might not even want to eat. But there is always a cause. So or it could be purely feeling low, or it could be an infection wherein she's actually not the body she wants to eat, but she's not. There are plenty of causes, but nutrition is, of course, very important. So, for example, in cases of dementia where you might actually want to give food, the food itself might confuse them. So, that's why there are a lot of dementia specific utensils which have come where which are like sippis. So there's not much effort needed. Now lack of teeth obviously becomes a big problem because consistency of the food obviously has to change. So I think the causes could be multiple. I feel the more important is to look at the cause of why she's not eating rather than concentrating on the cause that she's not eating. Because
yeah.
if you don't know why, then it's only going to be an uphill battle wherein she won't eat and you will try to make her eat. So I think knowing the cause is always the most important thing. And mostly older people do. We are able to figure out in most times there is obviously a cause for everything. Nobody, to be very frank, acts out things. Ultimately, we are all human beings, wherein eating is one of the most important parts. And
Yeah.
of course, if that goes down, usually it's downhill from there. So we obviously want an older adult always because muscle mass goes. then organs obviously get a bit more weaker. So yeah, I mean, a lot of times you have to supplement them. So for example, you might have to give IV fluids, you might have to actually give external so that they are maybe strong enough to actually start eating orally.
Yeah. Oh, thank you.
Anyone else with a question? Um, okay, I have one question, Dr. Prem, which is to do with uh, because you are a specialist with geriatrics, and many times when you have to, get advice from doctors for your parents, for example, in my case, um, we obviously do not know that, whether those doctors specialize in understanding the particular needs of the seniors, and so, we don't always also get the right um, signals sometimes, about how a doctor would approach a senior versus someone who's not. So, just like that is, just like you are a geriatric specialist, I assume that is not something that we can expect of all the doctors, right? In the sense like that is something that we have to go with in good faith to most of the doctors and get them to make their advisory according to the person that they're dealing with. My the where this question is coming from is that once my grandmother, she had an issue with her teeth, and during one of the sittings with the dentist, I think she got such a shock because of something that didn't go right, and that essentially sent her into about 10 or 15 years of life where she could not communicate anymore, and that was obviously very difficult for the rest of the family. But now one never knows that, when you're going to a dentist or to a specialist in some way, that how they would understand also the needs of the 60 plus versus those who maybe don't tend to do it in a very specialized manner. So it's a very broad sort of a question, but is there some way to know better about, how to get your seniors the right attention from the doctors that you are going to?
No, I think most specialists, in fact, most commonly dentists, which I know, I mean, at least the past and current generation now, they know that most of their patients are older adults. So they are sort of better. So, I mean, the way they do it is they actually do some online courses, or they have talks in which, so I have also been involved, wherein they actually get to know better about how they should care differently for older people. Of course, geriatrics as a specialty is still developing, but as pediatrics, also when pediatrics started, people didn't really understand its importance. But as we know that, I mean, by 2050, we are almost expecting maybe even more than around 13 to 20% of our population being above 60. So, which is a huge number. And we already know that population aging, wherein the number of kids is also going to reduce, and it is already reducing. So the burden is tremendous. I think sensitization and knowledge is where things come in. So I know a lot of specialists who are actually very good with old people as well. And then certain are who obviously are focused on their organs, and I don't blame them. So for example, if there is a cardiologist who has to see, then there are 100 more patients waiting for him with their cardiac problems. So I think, I mean, having a geriatrician on board always helps. And I am always already also seen that in general, their behavior and their, I mean, conversation with older adults always much more different, maybe as compared to a younger person. But we are getting there, and I think it's the onus is on us as a society and also as geriatricians. Uh, so I think that's where it is. I mean, I feel anywhere it's not about thinking why they are not doing. It's about sensitizing them what should be done. Because if the buck is always put on others for them to learn,
Right,
I don't think that's the way it works. And it comes from the older adults themselves, wherein their knowledge about their aging also should increase. Because what happens when they'll become 80? What happens when they become 90? What happens become they 100? Because it's happening. I mean, people are living till
right.
100, people are living up 90s. So I think more and more resources and more seeking knowledge is where we should be, sort of taking the lead.
Got it. Thank you for that input. Okay, we are now open for the last question of the day, and we are getting towards the end of the episode. Any more questions? Okay, I don't see any responses, so I think we can take that as a sign, and we can close the session today. Dr. Prem, I think it was a great first episode. We've not had too many 60 plus members on the call today, but I'm sure we will have many more as we go on, as we're just at the beginning of a journey. But these conversations are very valuable, I'm sure, not just for the seniors, but also to people like me who are caregivers. And so I thank you again for your participation and for sharing your knowledge and experience about dealing with geriatrics as a subject. And we look forward to having you back the week after next. So yes, thank you very much. And
Thank you.
yeah, we can close the session for now. Okay, bye bye.
Bye-bye.
Thank you.
Thanks, Doctor. Bye.
Thank you, doctor.
Thank you very much, Doctor.